the Narayana chain and the value that it provides to us. And I think after that, few more questions that I'll also ask. Okay, please.
Good morning all. I'm very happy to see a young and energetic crowd here. Am I audible? So you must be wondering why this unfamiliar face here. Okay. So I just wanted to take this occasion to just represent my hospital here. How many of you have visited Narayana Health here? Okay, good. I could see a lot of hands rising. What is the let's say purpose of visiting hospital? Why I am asking this question is, most of the times, why do you go to a hospital? When you have an ailment, right?
Emergency?
Yes, emergency, when you have some health issues. But I just wanted to say, no, what are the commonest emergencies you want to visit a hospital? Fever? Dehydration, very good. So now I would like to tell you this many of the times we are receiving in this vicinity, we are receiving young crowd, young patients with symptoms of chest pain, breathlessness, strokes, seizures. Do you have any idea why this, especially, so these heart diseases, strokes, all these things are very common in not so young age but older age, right? We always thought like this is a disease of old age. But nowadays, I think I'll not take much time. Please bear with me for 5 minutes. Okay. Well, because I just wanted to tell few things what we are seeing nowadays in our emergency. Okay, a lot of young crowd, they're coming with chest pain, breathlessness, seizure, strokes. Why is that? That's the question I just wanted to just elaborate. We are seeing in 30s, mid 30s, 40s, we are getting a lot of patients, especially in this HSR community. I don't know, so many of the times we try to analyze the reason why they are coming to hospitals with such symptoms. Do you have any idea? Exactly. So we have, I think the crowd, what I see is majority of them, believe me, they are IT crowd. Majority of them, of course, others are also there. But why we are seeing, say, these heart ailments, heart diseases, strokes, seizures in young crowd? Yes, of course, what he said, what this gentleman just now said, it is very true. See, a lot of lifestyle changes. What does it mean? It means we don't eat in time, we don't sleep. I could see in HSR like night will be very active rather than days. Night will be very active till 12 o'clock, 1 o'clock, people will be roaming around. They'll be, say, eating in the eateries or more, yes. So that is one thing, and they don't sleep well. Night, they'll be very active. And daytime, I say 8 o'clock, 9 o'clock, I don't see any shops open, I don't see any people wandering around. So this is one thing which probably would have contributed to this such ailments. So why is this? Yes, of course, whatever lifestyle we are having now, probably it is the need of the work, because a lot of IT crowd, they work as per say other countries, this thing, timings, US, UK and all, they say require different time zone. That is of course correct, but what are we doing by doing that? So we are losing our health. So what I wanted to say is, please keep a tab on this, say, lifestyle. Means you eat healthy, you sleep good 6 to 7 hours, right? And you please make a habit of having exercise, proper exercise regime. And whenever one thing what I wanted to tell you people is, one thing, never ever neglect your symptoms. So many of the times, if I see this in my emergencies also, they come with chest pain, they say, sir, gastritis, muscle pain, I worked out on muscle pain. But don't neglect. There is no harm in taking one ECG or simple investigations like echo, so that say we can at least know that there is nothing related to heart, nothing related to stroke, or nothing related to any other thing. So please, what advice on this very occasion of Onam I would like to give you is, please don't neglect your symptoms. Okay, whenever you have symptoms, your neighborhood hospital is there, but whichever hospital you would like to go to, but in the vicinity it is very nearby, don't neglect your symptoms. Please do present to the hospital with whatever symptoms, and relevant investigations. And what I recommend, those who are 40 plus or 50 plus, every year please get one simple health check done. So that will sort out most of the issues. If you are 60 plus, please every year make sure that you get this health checkup done. Okay? Yeah. So this is the piece of advice I would like to give as a doctor in your neighborhood hospital. And I am open to any questions if somebody is having a question.
So anybody has any questions?
Yes.
Okay, there is a question over there.
Yes, please.
When you say that there are symptoms that we should not ignore, what are these symptoms
Yes.
that you...
Yes. Especially what I see is chest pain. Chest pain is one predominant symptom, right? Whatever chest pain, say sometimes, say those who are, say diabetic and they're on treatment for a long time, in this patient, cases especially, so symptoms will be masked. You will not have typical chest pain. Say just a heart attack like pain you will not have. But even if slightest of the pain in such cases, no, don't neglect. Please take an ECG and echo and get it evaluated. And this chest pain is very important symptoms. Please don't neglect. Even if you are getting shelling out 1 or 2,000 rupees to get an ECG or echo, don't worry. Please get it done. Okay, if it is normal, you'll have some relief there, right? So, and the other symptoms are, see what I am seeing in especially say young crowd, seizures, atypical seizures, means fits. Some say jerky movements, they say like probably because of dehydration, all these things they neglect. Don't neglect. So we are seeing 20s, 30s strokes nowadays. So not to mention on this occasion, but at least I'll tell you. Say, we are seeing a lot of patients with seizure. Seizure, don't neglect. Get it evaluated with the neurologist. We have very good neuro facility here. And again, breathlessness, giddiness. These are all the symptoms which you should never neglect. Okay. And see, whenever you have these symptoms, I think we have in our vicinity, I think we have, say, mobile ambulances. So one ambulance is stationed right in front of the gate. So even if you are overutilizing also, don't worry, okay? We are not going to charge for that, but make use of the, say, ambulances. You can come to emergency directly and get it evaluated, okay? Any other question?
Any more questions? I think we have one more.
Yeah, I have one query. See, usually that you have that golden hour something
Yes,
involved, right?
yes. I would,
So what?
yes, I would like to tell about golden hour. One thing is, say whenever you have this chest pain, if it is evaluated early, right, recovery will be 100%. Okay, and even the stroke, what we have something called as, say, window period. Window period means wherein like once you develop the symptoms of say weakness or slurring of speech or some altered sensorium. If you present to an emergency way stroke ready hospital within 4.5 5 hours, there is something called as say thrombolysis. What we do means we give IV medications to dissolve the clot. Okay, and yesterday only, say I got a call, just I'll take 2 minutes. I got a call, say they said they were getting ready for dinner. So mother, she wanted to drive. She sat in the driver's seat and she wanted to stretch. Suddenly she is developed slurring of speech. Within no time, 10 minutes, they called, sir, these are the symptoms. I think she is just exaggerating the symptoms. I said, no, don't neglect. But when they went to the nearby hospital, they found there is a large clot on the left MCHL. They thrombolized within half an hour, she was all right. So that is why please don't neglect. And if you come to hospital within 4.5 hours, definitely stroke outcome will be much better. Believe me, and you don't have to go through all those things, right? Because once what we call as time is bride. If you lose each minute, many million neurons will be dying. Right. Stroke, you please don't neglect. Present to the hospital as early as possible. So there is always say good outcome when you reach the hospital early. Yes, sir. I hope I addressed your query. Right. Any other questions? Okay. Thank you for providing me an opportunity to talk to you. So happy Onam to you all.
Thanks a lot, doctor.